Hi, I'm nursing instructor James. Today, we have special guest, social worker Avery Larkeye in to talk about access as a social determinant of health.
Thanks, James. Access to health services has a broad range of factors that affect individuals and families. The main considerations we will cover today are financial barriers, education and ability, physical environments, and social exclusions.
Clients face many barriers to accessing health services due to a multitude of individual and systems-based reasons.
Health equity. Financial barriers.
Although Canadians have a publicly funded healthcare system called Medicare, financial barriers to access still exist. Medicare only covers 70% of total healthcare costs, with private pay insurance plans supplementing some of the additional balance, along with out-of-pocket spending for services such as dental and pharmaceuticals. Limited access to telehealth disproportionately impacts low-income households, with only 58% having access to high-speed internet connections compared to 98% of high-income households, proving that Canada has a long way to go to achieve equitable access to healthcare for all.
Literacy and ability. Ability affects access to healthcare due to a wide range of impairments, including blindness, low vision, deafness, learning difficulties, cognitive limitations, limited movement, speech difficulties, and photosensitivity. These disabilities can decrease physical and technology-based access to healthcare.
People with limited health literacy report a poor understanding of and adherence to medical regimes and poor overall health. As such, they are more likely to be hospitalized, increasing demand on public services. Physical environments.
Intersecting stigmas and discrimination interact to produce social locations with varied access to power and material resources.
Remote regions face restricted access to transport and communication outside the community. Rurality also commonly intersects with poverty and habits such as smoking, which makes these populations vulnerable. The isolation and limited access to resources can be especially challenging for older adults who face disproportionately higher rates of depressive.
Social exclusions. Health inequity refers to health inequalities that are unfair or unjust and modifiable. For example, Canadians who live in remote or northern regions do not have the same access to nutritious foods such as fruits and vegetables as other Canadians.
Structural racism, patriarchy, and heteronormativity impact the obtainability of adequate health care due to race, gender, sexual orientation, immigration, class, religion, disability, and health status. Each of these contribute to stigma and discrimination that affect access to quality care.
The following are some examples of decreased access to health services that I have come across in my work. I had a client come to the city centre UPCC that only spoke Farsi. None of the staff spoke this language, a translator wasn't available, and our translation device didn't have it as an option.
Another time, a client arrived at AVI Health and Community Services who was unable to access affordable medication because they didn't have an active MSP account. Their difficulties included a low literacy level and no access to the internet or a smart device due to poverty.
Okay, let's complete a case study. Together we will explore how you might assess an individual for access to health services. Assessing the individual.
Bill Johnson, 32, is an unhoused individual living in the downtown east side. He has a history of opioid use disorder and reports he would like to receive treatment for Hep C. He states that he does not access the clinic where his old family GP practices because he feels stigmatized by the healthcare staff. How would you support Mr. Johnson to receive appropriate care? Assess and discuss his barriers to accessing health services.
Step 1. Use relational inquiry to develop a therapeutic relationship with Bill. Step 2. Create helpful boundaries and to support the relationship by getting consent to provide care to Bill and discuss his health needs with the interdisciplinary team. Step 3. Communicate potential barriers with the team that could be limiting his access to healthcare. Examples of these restrictions could include finances, transportation, mental health, and fear of stigmatization related to addiction.
Step 4. Discuss with the team how to navigate the barriers to support access to health services. Step 5. Engage in client-centered care. Include the client in ongoing discussions around their health needs. Value their lived experience and expertise. Provide harm reduction and trauma-informed resources to meet the client where they are at. Support continuity through the lifespan by facilitating collaborative care. Wow! Thank you so much for your wonderful presentation, Avery.